Is there a connection between repetitive strain injury and arthritis? And if so, what is that connection? Here to answer our question is our chief medical expert, Dr. Robert Markison, San Francisco hand surgeon. Welcome back to the show, Dr. Markison. And what can you tell us about arthritis and repetitive strain injury?
Well, look, it's a fact of aging and a fact of some endocrine and metabolic factors that people can develop wear and tear in small and large joints. We know from the spine and large joints and spine surgery and large joint replacements that those are going to continue to be trouble as long as we're in the Earth's gravitational field. Where it gets to small repetitive members like the hands and their little joints, it's a question of the positive side, use it or lose it. If you don't use it, you could get all kinds of stiffness. If you overuse it, you can transmit too much load from fingertips, for example, on a keyboard. 1 ounce here is 2.5, 5, 7.5, 10 to 12 ounces here. So the transmission of load. And then percussive typing will aggravate the condition. So that goes for texting too, which will run, and we've talked about this previously, a lot of force through this precious, valuable set of thumb joints, especially the basal joint where thumb joins the hand. But there are different flavors of arthritis. There's rheumatoid arthritis, often happening in age 30s and 40s. Osteoarthritis happening a little bit later. And in between, where even the best of rheumatologists will admit some osteoarthritis, some rheumatoid arthritis, both negatively interacting. There's gouty arthritis, and everybody thinks it's just Galileo up on an ottoman with a sore toe, but gout can affect any joint in the body. And the people who I have who have a little elevated serum uric acid, which is the marker for gout, if their diet is wrong, too high in purines, purines account for 40% of synthesis of uric acid, which is the culprit ingredient in gout. They lower their purines to get better. Now, gout can accelerate osteoarthritis or at least negatively interact with it. And so we're talking about a metabolic backdrop, an endocrine backdrop, because small joint pain in the hands can be the harbinger of hypothyroidism. Oftentimes people will come in with multiple small joint aches and pains with or without the classic fatigue of hypothyroidism, maybe a little snoring, sleep apnea, and so on, maybe a little bit of cardiac arrhythmia, or maybe a known mitral valve prolapse, or any of the myriad symptoms of hypothyroidism manifesting in the hand as arthritis. And then it gets aggravated by single tasking and repetitive use. So back to the question of osteoarthritis and RSI. You have to be careful. Avoid percussive typing. Keep the joints well lubricated by staying well hydrated. Mind your diet. It's incredibly important. And we've gone over some of the nutritional aspects, but obviously if you're taking probiotics and prebiotics, you'll have a microbiome that fortifies your bacterial flora. If you're avoiding high lectin content foods like wheat and a lot of other grains, nightshade vegetables and so on, then you'll be fortifying the intestinal walls to avoid leakage of inflammatory mediators out into joints while you're repeating your activity. And so a little surveillance, endocrine surveillance, metabolic surveillance, take your vitamin D3. Liquid form works, capsules and gel caps don't, because a little low D level will negatively impact osteoarthritis, which in turn will give you a negative backdrop for any repetitive use of hands.
You talked earlier about purines. Can you
Yes.
define them and talk about where you would ingest them?
Right. Your DNA breakdown products are called purines, Purines, and pyrimidines. You're naturally breaking down your DNA all day. We replace ourselves in pieces all day. As you probably know, a white blood cell lives 5 to 7 days, red cell 120 days. The skin is shedding continuously. The guts are shedding and so on. So anyway, we're breaking down our DNA. And as we do so, we break it down into uric acid, among other components. And so uric acid can overwhelm the kidneys, and for failure to adequately excrete uric acid, it rises in the blood, which in turn can cause the large print edition of trouble, which is gout, usually affecting lower extremities, feet, big toes, but also wrists, thumbs, and so on, small joints. And so again, it can also cause carpal tunnel syndrome by thickening of the stuff around flexor tendons, can cause lumps and bumps called tophi, you name it. Anyway, the purines, 40% of uric acid synthesis comes from dietary purines. And so if you take a low purine diet, and there are plenty of good lists on the internet of low purine diets, then you do better. You have fewer gout episodes.
Purines, can you give me an example of what sort of food would be a high purine and what would be a low? I mean, I'm thinking leafy greens versus.
Yeah, you're right.
French
Leafy
fries.
greens, cruciferous vegetables, and so on. They're pretty harmless, and they're very, very low purine levels. You get up into sardines and some of the other oily fishes, and they can have a variably negative impact on it. And you get into lamb and organ meats, and you've got high purine levels. And so again, looking at hot and cold regions, meaning high disease prevalence in the globe, on the globe, or low disease prevalence, cold zone on the globe. Those who are eating high purine levels, a lot of lamb and so on, are having higher prevalence of gout. And that can be independently disabling.
Now, something you said is there's two things you brought up. One is the purines and the gout, but the other is hypothyroidism. And in both cases, it sounds like your arthritis might be reversible if you change your diet or made some other lifestyle adjustments, because maybe it's not arthritis, but it's gout or hypothyroidism. Am I reading this correctly, understanding it?
Right, but the radiographic appearance of the joints will not change. But the question is an arthritic joint symptomatic? And there have been large studies in the radiology literature confirming the difficulty of correlating radiographic appearance of joints with actual symptoms and functional challenges. So there's a disconnect between what you look like on an X-ray film and how you feel. You could have minimal arthritis in the hands by X-rays of the hands, have maximal symptoms because you have undiagnosed or inadequately supplemented hypothyroidism. And so, yes, the metabolic and endocrine backdrops in which you live and thrive or don't are very important. And that's something to remember. And so it's a nothing to get thyroid function tests, notably T3, T4, free T4, TSH, TPO, which is anti-thyroid peroxidase antibodies. Get that little normal screen and find out if you're hypothyroid. It's no shame to be hypothyroid. In fact, it's one of the easiest and best controlled conditions anybody could have. So it's a wonderful thing to figure these out, because you may have X-ray changes that could spell doom, and yet they're totally non-symptomatic.
That's so interesting. The other thing that you touched on earlier in this interview is the idea of movement. And when I was in school, I learned about compression and distraction, how when the joints, that's how they get their nutrition, is by movement, by compressing and distracting the joints. So I'm wondering if it's worth it to do some tendon glides before you begin your work at the computer, or, just something gentle to sort of get the synovial fluid going. Because I know arthritis response. I mean, one of the things that you want to do is move. Motion is lotion.
Yeah, I agree. Absolutely. I mean, just as you have those compression and release, sucking in synovial fluid, which was both nutrient and lubricating in joints, and it's this push, pull, expansion, contraction thing that kind of sucks it in and then it flows out. So you have a lift and flow through teabag effect there, but you also have it in tendons. And so if we take one of the tendons out of my hand, we cut across it, we're looking in cross section. The palmar, 40% of the tendon is canaliculi, canals that are arrayed three-dimensionally. So you have a porous tendon surface. As you move it, you suck in synovial fluid, which is again nutrient and lubricating. And so you're moving it through the tendon. You have inflow porosity, canal system, outflow stalks, vinculi in Latin. which flow out through venules and lymphatics, very dynamic inflow outflow. If you stop moving, not only will your joints suffer, but your tendons will be kind of glued, not stuck by it in adhesive terms, but they'll be kind of full and not emptying. So the hand is a dynamic pump. You close it, it turns white. You open it, it turns pink. So that's a dynamic pump of inflow circulation, outflow circulation. Very important. That's movement, motion, lotion, as you say. And that encourages not only blood flow in and out, but also synovial, because we're in a bath. The brain is in a bath of cerebrospinal fluid circulating through around brain and cord. The tendons are in a bath. The joints are in a bath. The quality of the bath water matters. Its movement and refreshment matters.
Yeah, well, on that note, I think everybody should get up and take a break and start moving to get their synovial fluid and blood flowing and lymph and all that other good stuff. Thank you so much for this excellent segment, Dr. Marcus, and we just can't wait to have you next time. And we're going to be talking about the role of fatigue and sleep. So everybody come back and watch that.